The chapter that I decided to review was Chapter 10, Poison Control. The reason I decided to review this chapter was because it was very interesting to me. A lot of helpful things in there and things that I didn't know. The first thing that I would like to discuss is what a poison is. So poison is a substance taken into the body by ingestion, inhalation, or absorption that interferes with normal physiological functions of the body. The first section in this chapter is poisoning by ingestion. This is the most common type of poisoning is by ingestion or swallowing. Children between the ages of 1 and 5 are at the most risk for poisoning. Before 2004, if a child had swallowed or inhaled a poison, it was recommended that an emetic ipecac syrup be given to reduce the vomiting. But after extensive research, the American Association of Poison Control Center had several concerns. Those concerns were the outcomes failed to justify its effectiveness, the adverse effects such as persistent vomiting could interfere with other treatment. There was also evidence that people with bulimia and anorexia were abusing the ipecac syrup. If you suspect any poisoning, you can contact the Control Center at 1-800-222-1222. Again, that number is 1-800-222-1222. You can also contact an emergency care facility. Based on the person's age, size, and condition, instructions will be given for the appropriate emergency treatment. If vomiting occurs, an antidote may be given. Now, antidote is a substance that neutralizes poison or toxic substances. Some may be required in poisoning with CNS depressants. Some examples of antidotes are flumazenol or naloxone and CPR. Again, the examples of antidote were flumazenol or naloxone or CPR. The next section in this chapter is poisoning by inhalation. Poisoning by inhalation requires symptomatic treatment such as fresh air, oxygen, and CPR if indicated. The next section in this chapter is external poisoning by the skin or the eyes. If external poisoning should occur in the skin or on the skin, it should be flushed for 20 minutes. Now, if it occurs in the eye, a continuous stream of water should be used for about 30 minutes. And the next section of this chapter is poisoning by sting and snake bite. If you get stung by a bee, a wasp, scorpion, or a fire ant, you should treat it first by cleansing the affected area, quickly remove the stinger, and apply an ice pack to the affected area. Watch out for allergic reactions. If you notice any allergic reactions, CPR may have to be administered, and an epinephrine as well as a corticosteroid may be required. Some people carry an epinephrine auto-injector for self-injection or for someone else to do it for them. After emergency care is treated to lessen the pain, discomfort, as well as any redness, a topical corticosteroid ointment may be applied. With a snake bite, you do not want to apply an ice pack. Venom is very irritating. You want to keep the patient quiet in order to slow circulation and transport the patient laying down to an emergency care facility for anti-venom injections. Now, anti-venom injection is a serum that contains antitoxins specific for animal or insect venom. The next section in this chapter is people at risk. Poisonings are the leading cause of health emergencies for children in the nation and a major cause of death among young children because of their natural curiosity and active lifestyle. the danger and particularly great with flavored medications such as aspirin or iron tablets. Like mentioned earlier, the most people at risk for poisoning is the ages between 1 and 5. To prevent poisonings from happening, there are some things that could be done. We could lock all chemicals in a cupboard, keep medicines that aren't used a lot in a lockable box, drugs such as pain pills or any prescription medications that are used frequently, make sure they are in a child-proof container. You could also put a sticker on it for the younger children who can't read. There's a sticker out there that's called Mr. Yuck. It looks like this. And I'm going to bring my 7-year-old daughter in here and have her tell us what she thinks when she sees this sticker. So Journey, when you see this sticker, Mr. Yuck, on this bleach bottle, what comes to your mind?
It's like, it's poisonous, and if you drink it or eat it, then you might get sick or die.
Yes. So, again, if anything like this ever happens, the number to the Poison Control Center is 1-800-222-1222. Thank you.